Well, good morning. My name is Santiago Garcia. I'm an interventional cardiologist in Cincinnati, Ohio, and we're truly excited to be part of SOLACI 2026. Before we show you a live case of a transcatheter closure of a patent foramen ovale, we would like to highlight a technology today, the Enhanced Radiation Protection System, EggNest. This device comes in 3 different versions. We're going to show you the complete, which is the most advanced version of this device. And we purposely decided to start filming before the patient comes into the room so you get a sense of how the technology looks like. And I have one of the specialists from the company here to walk you through the setup.
Thank you, doctor. My name is Wes, clinical specialist with the EggNest. Now the EggNest as it sits here on the table is 97% reduction of that radiation for everybody in the room. And then with the complete shield brought into the room as well, that gets up to 99%, where our doctors and our scrub techs are able to actually take off of that lead. As it sits here, what the components are actually on the table, being the protect, being the 360-degree skirting, as well as all that you see here on this carbon fiber sled. Now, these are all components that are modular and come in pieces so that for any kind of case type, setup, procedure, anatomy style, they are very flexible. For that same reason, they can come on and off. And everything below the table takes care of all of that scatter radiation that every position is getting us to that 97%. That is the skirting here that not only are lighter than your traditional skirting because they are made of our proprietary mix of non-lead equivalent, being bismuth, tungsten, and antimony. They also are allowed to flex so that while you're getting your angles, we're able to get any of those hard viewpoints that our doctor will need to get during the case. Otherwise, when it comes to above the table, I mentioned even the mattress itself has some of these radiation attenuating properties built in, and the rest of our pieces are very light as it is made of carbon fiber, like you can see here, with that non-lead equivalent built into the system. Now, that makes it all very light, about 70 pounds total, making it so that we can obviously get any patient size on here. Once we load the patient, we simply have these flipped up. I'll deploy these quickly for you. And again, this works with any kind of case, both cath and EP, vascular, hybrid, you name it. Where we are able to do that is especially with the EggNest system. It is one of the only kind that is able to protect the head of the bed here, especially for an anesthesiologist, anyone who might be getting an ACT, or in your particular procedures that need to have access around the head. The reason we are able to protect the head so well is because we have 360-degree skirting with this head wrap, concluding anybody that might be towards the patient's head on this table.
I think for our audience today, we're going to be doing a groin case, a structural procedure. But maybe you want to talk a little bit about radial setup, because now that's, I guess, the most common access site for diagnostic and PCI. So this is essentially a system that is very flexible in terms of access site and is somewhat agnostic to both femoral and radial. So maybe speak a little bit about the setup. You can see it takes really no more than 10-15 seconds to go from a groin case setup to a radial setup.
Absolutely. Just as he said, it's a very quick setup going between the 2 access sites. It is important that each of our pieces are designed to be able to be flexible around those places, because we're able to curate the protection per case and per procedure as well, just like this. So this is our radial arm board setup that we have, also a workbench, so that Dr. Garcia is able to walk out his wire if he needs a little bit of extra space to set anything down. That's there as well. And then this can then, in the modularity, like we mentioned, be able to work with the patient's ergonomics and come into their armpit here, where there's also an increased protection as well for that same reason, but allowing us to do all of these different type of cases, especially like this radial here in the cath setting.
All right, I just wanted to show you quickly the setup that I'm going to be using for this case. So I do have the ray safe here in my wrist that's going to tell me the radiation exposure inside the lead. And then I have the light lead, which is like a sport jacket. I can lift this with only one finger. It's a 0.125 thickness. I'm going to have another dosimeter on the outside of the lead, and that's going to give us a sense of what's going through the patient and also what's going through this lead. At the end, we're going to be very close to zero. That's my prediction. And then I think the operator will have the option to decide whether they do these cases with light lead or no lead at all. We have obtained bilateral venous access. We have a 12 French sheet for device delivery on the right side. We have an 11 French sheet for the ICE catheter on the left side. But what I wanted to show you is that the system also comes with disposable. So we're going to have this extra shield. It's going to give us some extra layer of protection here around the access site. And in addition, the patient has also under the cover, there is shielding all the way up to the knee. So I think we are essentially covered 360 around the lead. It's around the patient, not around us. And that's why we can do this now with either light lead or no lead. So we're going to get to work here. This is our big shield that is a little bit wider and thicker than the standard shielding. And also going to give us another layer of protection here. All right, so just finished here. We have a total fluoroscopy time of about 11 minutes with a DAP of 17. And you can see these are monitors like monitors. We only got zero radiation. Outside the lead, inside the lead for the primary operator and also for the first assist here. So I guess this is excellent, and we just wanted to highlight technology, and thank you for allowing us to be part of the conference.